Thank you very much. I have to say that, when you give such a long introduction, you get scared of your own self. So we have a fabulous panel here, and I'm not going to get into too much detail about what they've done, because when you hear them, you will know what we're talking about. And in today's conversation, what we're basically going to be focusing on is how data informs every aspect of our life, every aspect of our programming, and with specific context to the work that we do on health, nutrition, well-being, livelihoods, and blended finance. And some people ask that what is the criticality of data? Data is in everything that we do, every piece that we work on, every decision, even small decisions like what we're ordering, what the rating is, and how national programs are designed and managed and implemented and reinvented. So I'm going to start our conversation today with Dr. Sapna Poti, who, as you know, is the Director of Strategic Alliances at the Office of the Principal Scientific Advisor to the Government of India. She's the visionary behind the whole the whole establishment of RUTAG, which is something she's going to be talking about. She's presented this model of Manthan at a summit where there were 26 prime ministers and their delegations present. She's also led the process of setting up the social stock exchange. So she's truly a pioneer in her own way, and she's already got 2 other panels in different parts of the country lined up for today. So what we're going to do is I'm going to request her to talk about RUTAG and the Smart Village concept. And after that, she has to leave for the airport. We're already cutting it too close. So over to you, Dr. Poti, to talk to us really about where the opportunity is. No, first about what the model is for us to understand where we are and where there is an opportunity for collaboration.
Sure. Thank you so much. So the thing is that, as you're all aware, there is a large set of startups who are developing several innovations in India, right? So across the SDGs, from water to sanitation, agriculture, education, and so on. So these people actually need an access to market. And then we have a whole host of rural India where the technologies are not reaching. And so how much of papad and pickles are we going to do, right? So how do we have livelihood and entrepreneurship with technology as a catalyst is what RUTAG Smart Village Centers are all about. So the first thing is the technology penetration is hardly 1 or 2%, which means some motors, some irrigation innovations, and suddenly we have drones. There's nothing in the middle, right? So this concept is about taking integrated technologies in a very structured manner. So one can always say you have common service centers, you have KVKs, so what are they doing? They are in the BDO and the district level, and there are very few people trying to address the entire district. It's absolutely impossible. And that's why we said we need to have rural smart village centers, and we call it RUTAG Smart Village Centers, and I'll tell you why. In the village panchayat level, addressing about 10 to 15 villages, so that they have deeper engagements. Because technology adaptation is not easy even for us. Today I was struggling with Digi Yatra, right? Being so educated and everything. But we need to ensure that we come down to the level of people who need to understand these technologies and not just keep talking blockchain and AI and all that in the labs. That is why this Rural Smart Village Center is unique in that nature. The second point is that there is a hub and spoke model. So there are a lot of safeguards. Why did this RSVC, as we call it, RUTAG Smart Village Center, why did it get a stock exchange price? Because there are a lot of safeguards here. The first safeguard is there are multiple implementation agencies here, so one implementation partner cannot monopolize this entire thing. The second one is that we need to have tracks for each of these. So for instance, a sustainable model is what we are looking at an RSVC. So the lowest denominator is agriculture services or wash services, which most of you must be already providing. So that ensures that the RSVC development does not need funding every year, at least the infrastructure. We're not building new infrastructures. I don't have any great interest in building Taj Mahals here. Whatever is already there on in the village, they are more than happy to offer you. I've personally gone to these villages, though actually we don't get into execution from the Office of PSA, obviously. But I've gone there to understand if there is a need, because only then we do this. So they have given us areas, they have given us rooms, so we convert that into rural smart village centers. The implementation partner always needs to have a lowest denominator of the RSVC being sustainable. That's very important. The second layer to that is RUTAG. RUTAG is what the Office of PSA has been funding about 11 IITs from several years. You would be aware that Dr. Abdul Kalam was our first principal scientific advisor to Government of India, and now we have the fourth principal scientific advisor, Professor Ajay Sood. All the four principal scientific advisors have been very interested in rural technologies, and hence RUTAG has continued. Now is the time to deploy that on the ground, and that's why the 11 IITs, the technologies that they have built is free technology transfer. Or the fabricator needs to move to that particular RSVC and implement it. It's as simple as that. And hence, technology is available as a second layer. The third one is in terms of tracks. The third track is the education technology. So that is something that we are talking to Dell Foundation as well as Azim Premji, etc., to see if they would be interested in supporting this track. Renewable energy, we have talked to Selco Foundation, and they are very happy that RSVC's renewable energy track is what they would be supporting by selecting innovations from Manthan, which is a platform which I have architected and built, and I think almost all IITs, NITs, IIITs, DST, DBT labs, Social Alpha will grow, and literally every startup of which is working on science and technology is today using the Manthan platform. And that's what got the World Government Summit award, where 26 prime ministers over the 3 days saw that, the platform. So these innovations are now being selected. And so how does that get selected? Through a technical framework. We have something called the village readiness level. Your innovation can be technology level, that is TRL level. It could be market ready, but maybe it is not village ready. Is it cost effective? Is it, does it generate livelihood? Does it generate entrepreneurship? So the entire framework has been developed by selecting complete technical committee members from IITs, IIMs, Will Grow, Social Alpha, and iCreate, IIIT Surat, and so on, the whole spectrum. And that framework has been passed on to Indian Institute of Science. A team there is now parsing the data from Manthan platform and looking at these tracks, looking at which of them are village ready, then passing it on to the track lead. So that track lead could be, like I said, Argyam or Dell Foundation or Selco Foundation and so on. And they are the ones who will then clear and have a agreement with the innovator so that the innovator does not disappear, because that will be disastrous for us. And hence, those which are scalable innovations go through these RSVCs. This is the complete model that we have. Now, talking about collaborators and how all of you can collaborate. The CSR organizations obviously can put up RSVCs. It's just 15 to 20 lakhs per RSVC because we are not developing anything new. It's a prefab for 20, 25 years that can last, or it is a pre-existing room that is converted. Minimum of 2,000 square feet, obviously, because we need to demonstrate the innovations and we need to have a training room so that we teach them water, sanitation, education, agriculture services through that training room. So that's point number one. Point number two is that you could be owner of any of these tracks. We could have multiple owners of education track, multiple owners. So if you have funding and you have an implementation partner, or you could use our implementation partners and our innovators, that's not a problem. So that's the other one, yeah. The second is in terms of, the third for the CSR is in terms of doing an impact study. After a year or two, you can say that we want to do an impact study of this project, and you can come forward and do that impact study in 2 years' time. We are open to that. We are transparent about it. So this is what a CSR organization can do. And what can the NGOs do? Like I mentioned, that the least denominator here is in terms of having a sustainable rural smart village center. So you can set up the rural smart village center based on our drawing and bill of material with CSR funding that you have, or we could organize that. But you need to have the lowest denominator of agriculture services or wash services, where the household or the villager is paying you. You are not dependent on CSR. That is how the RSVC will run, and all the other tracks get funding, and all the others have implementation partners. That's all. Thank you.
Thank you. That's very, very helpful. And the whole point of it being around sustainability and also being data defined at various levels. So whether it's at the village level, whether it is at the national level, there are clear indicators that you have to measure success from a technology point of view as well as from an implementation point of view. So a very clear framework for our partners here to look at ways of coming together. So just one quick question before you have to leave. If they need to get in touch with you or your office, what would be the mechanism for them to build that linkage with Manthan?
Yeah, so since we are also the co-host of this event, we have shared the email ID of Manthan, so you can write to that. In any case, Office of Principal Scientific Advisor, Strategic Alliances Division, all the email IDs are given on the website, and you could say that you are in a CSR organization and you're interested in that. You then receive a form from us, and you need to fill up the form in terms of a written commitment in terms of what you want to do. And if you are an implementation partner, we need to see your revenue model for 1 year to ensure that this RSVC is sustainable.
Fabulous. Great. So I'm not going to open it up for questions right now, because I'm sure there'll be a ton. And you've already given your email address, and your team is very responsive, I know that. So I'm going to let you head to the airport.
Thank you.
I genuinely hope you make it to your flight. And
Thank
you're
you
able
so
to
much,
enlighten
and I'm so
another
sorry
group.
that I can't hear you, but we'll get in touch. Yeah. Thank you.
Great. So we got our session started talking about a large, sustainable national program that is looking at addressing ways of bringing in entrepreneurship, an area that I know that people in this room are interested in. One thing that she did mention was that health is not an area that is envisioned as part of this program. So I'm going to come over to you, Dr. Zoya Rizvi, who's somebody I've known for 15 years now, and I have the highest regard for her. As a champion of one of the largest adolescent health programs in the world, the Rashtriya Kishore Swasth Karyakram, how do you ensure that there is participation of the audience that you want to work with this, which is adolescents and young people, and that it is that participation and that collaboration is defined by decentralized decision making, which is data driven. So I'm not asking you about any data about the national program, but the role that data plays in bringing young people together, in your collaboration from the national to the state level, and how that gets augmented to showcase to the world how important it is to work with young people and to run such a large program.
Okay. Hello. Yeah, thanks, Mida. That was a long question, but I'll try and make my reply a bit more concise. You all heard the name Rashtriya Kishore Swasth Karyakram. It is a mouthful, but quickly, just to say before I go into what data, how it is so important, just to tell you that Rashtriya Kishore Swasth Karyakram is a program which has multiple interventions. One of the very, quickly I'll tell you, one is called the adolescent-friendly health clinics, in which we have trained medical officers, counselors, and staff nurses to talk to the young people. Is it counseling as well as providing commodities as per the request of the young person. Second, we have menstrual hygiene scheme, in which there's provision of subsidized or free sanitary napkins to young girls, depending on what the states want, how many districts they want to cover, or what is the area they want to cover. Next, we have a peer education program in which we select peer educators from within the community. We train them over 6 days along with the local ashas, and these young peers talk among their own groups about the various issues of adolescent health, especially targeting the 6 thematic areas. One of them is sexual reproductive health, one is mental health, one is violence, including gender-based violence, then non-communicable diseases, substance misuse, So these are main themes on which they're trained and they talk to each other. And finally, we have the WIFs, the iron supplementation program, in which girls and boys in school and out of schools are covered by provision of IFA. So if you look at these 4 interventions, there's a lot of data which is happening there. So what we try at the national government is we ensure that the data entry is done by the implementing state or at the level of the block or lower level. So the data entry is done on the unified national portal, which we call the Health Management Information System, the HMIS. So that data is what we discuss with the states whenever we do any review. Out of these programs, we also have created dashboards and apps which promote, I think, doing away with the paper-based reporting only, so that more and more data comes electronically to us in real-time basis, and all the reviews we do on data-based. And now more and more funding which is provided to state is incentivized or disincentivized based on what is the quality of your data. So that, I think, is the beauty of program implementation now, is that the states have started owning the data. They become more accountable as to what the data entry is. So they, in fact, then end up ensuring that the people who are doing the data entry, who are putting in the reports, are adequately trained. So I think that is a big step which the government has taken, is that we ensure that the people who are reporting on time, because they are accountable to their own bosses, that the reporting is done on time. So this is something which is centralized. So besides that, what we also try and do is that we felicitate the states which are doing proper and timely data entry. So then it becomes a kind of healthy competition between states that, okay, this review I got an award for best data entry, or the most appropriate or accountable data entry. So that, I think, is very good, because for a country as vast as India, with huge geography and different cultural and sociological issues, it's good that they own up whatever they are implementing also. And next, of course, since health is a state subject, a lot of states innovate their own. They have their own dashboards also. But since all our indicators are standardized, so even if the states have a dashboard, it docks into our HMIS. So whatever indicators they want to collect, they may collect some 20 indicators, it doesn't matter, but the ones which are monitored at the national level are the ones which are a part of their dashboard also. So that, I think, we're trying to bring about a uniformity, so it's not that somebody's giving us 10, somebody's giving us 5. It's a uniform sector, uniform data collection is being done, and we do have a lot of data, I think, assessment. Even at our level, we are kind of answerable to our own bosses as to why the data is not coming. So it puts us also on our toes. So we also monitor very well, and we have very regular reviews, quarterly reviews with the state to ensure if they're facing any problem in data entry. And data entry becomes important because that's how we monitor a program. That's very easy to say, but that also it helps us tweak a program. If something is not working, why is it not working? Because states make their own innovations. They may say that this is the way the implementation cannot be done, why don't we do it some other way? So that is absolutely fine. So that helps us in tweaking the program, and also helps in improvement. Because once you start looking at data, you look at why it is not working, what is working really well. So that, I think, makes all the states actually think as to how they can improve. And that is how I think the programming becomes much better, because I think accountability increases.
Fabulous. And you talked about positive reinforcement, you talked about standard indicators, and that is so critical to designing a program. We often forget the need for positive reinforcement and how important it is to have data to be able to acknowledge the people that are doing that great work. And I'm sure, Sunita, that's music to your ears, having worked on data quality for as long as you have. Sunita leads strategy, financial planning, business operations, measurement and learning, and evaluation at the Gates Foundation, and is a dear ex-colleague. So Sunita, building off Dr. Rizvi's point, you've worked across academics, across conducting research, and now funding, evaluation, and also looking at the strategic framework where, again, data is very, very critical. So having heard what Dr. Poti earlier said and Dr. Rizvi now said, how do you see the role that evidence plays in decision making? We heard from a government perspective, but as you look at it from diverse perspectives, the role that evidence plays in decision making for policy and programming, and if you have some examples around high quality data and how that's led to some shifts, I'd love to hear from you.
Great. Thank you so much, Medha, for the question and for the invitation to come speak on this panel with esteemed colleagues. So I guess I'll start with sort of jumping off where Dr. Zoya sort of left off in terms of some of the very crucial kinds of data that the national government and state governments are using to monitor programs, and the kinds of impacts that they're having is, as Dr. Zoya mentioned, information that's fed into national portals and platforms like the Health Management Information System. Those kinds of data tend to be quantitative, so they're typically numeric, and they are, it's information that we typically assume comes from sort of an objective point of view or a standpoint. It's objective observations or counts of services rendered, kinds of practices that are being implemented, actual resources that are distributed, whether it's rations or iron supplements, et cetera, et cetera. That's one type of data. It's also important to recognize that the impact a program is having cannot be fully understood through objective quantitative information. The impact of programs are typically experienced by communities and by frontline health workers, right? And that experience of a program is typically more deeply understood through qualitative means, meaning data that actually captures people's experience of a program or experience of a service. And that is not entirely described through numerical data. So a lot of the work that we are supporting through the Gates Foundation in terms of generating evidence and insights on what kinds of programs are needed or how are programs actually reaching people and having impact, it involves collecting or supporting the collection of quantitative data and making meaning out of it. It's also the process of collecting qualitative data, actual stories and experiences that people have of particular problems or programs and making meaning out of it. Now, as we do this, it's also, we've recognized that it's really important to frame the questions from the point of view of the people who are, for example, making decisions. So, for example, if we were to support the Ministry of Health to better understand how RKSK is actually having an impact, we would sit down with our key stakeholder, in this case it would probably be Dr. Zoya, to understand what are the kinds of questions that she would like answered, what kinds of information would be helpful to her for the decisions that she would need to make. So we also understand that quantitative data may not be the only kind of information that a key stakeholder, such as the Ministry of Health, may require to make a decision. They may also require qualitative information. They may require information on the cost of a particular program, the cost effectiveness of a particular program, etc. So I think one of the things that I've certainly learned, sometimes the hard way, is to actually understand and center the kinds of information that decision makers need, as opposed to trying to imagine what kind of information will be helpful to decision makers. I think a lot of times researchers come in and we think we know what the problems are and what is the kind of information or evidence that decision makers should be using, as opposed to actually sitting down with decision makers to understand what kinds of information can they use and will they be interested in using to inform their decisions.
Fabulous. Sunita, I'm going to come back to you about another component or another segment of users of data who are the beneficiaries themselves. So as time permits, I'd like to come back because we focus a lot on the decision makers, but the true owners of the data also play a key role. And on that note, Niranjan, I'm going to come to you. You lead Pop Council Consulting, which is Population Council Consulting, which is one of the most reputed organizations, not just in India, but globally. And you've expanded the work in very many countries. I've had the privilege of watching you shape the work over the past many years. We've heard the importance of data, so you don't need to highlight that. I'm going to ask you a difficult question, which is my favorite job to do to you for years now. The amount of investment that goes into programming versus the amount of investment that goes into looking at how programming is doing, the timeliness of evaluations, the quality of data. And I was speaking to a CSR head before our session started, and she was mentioning to me that the budgets available for evaluation are usually the least priority, even though everybody wants to show results, whether good or bad. That openness is there. So as somebody who leads designing evaluation, raising funds, and conducting these kind of exhaustive studies, do you want to talk about the challenges that there are in first getting good quality data and reiterating the importance of getting timely data?
Thanks so much, Medha. I think that's a very important question and a difficult question too. I would simply say that, if you look at the whole investment in the social sector, whether it's on health, nutrition, or any other climate resilience and many other elements, there are three stages of the funding investment that goes. The one stage of funding that is where a lot of investment is more from the foundations, like say the Gates Foundation, or Tata Trust, and many of these foundations which are at a very mature level of the investment, where they see the real value of the data and answering the big question that exists in the field that says, okay, what are we, as a result of the program investment, what are we getting? What are the results that we are seeing? And has there been any failures? Or what are the successes if we have? And which models of those successes that we can scale up?
Or even course
But
correction for that matter.
Yes, because in the whole of the social sector programming, the pause and reflect is the key concept. Like Madam said, what mid-course corrections that we make.
And also
how
state
those
innovations.
And what state innovations, and what are the learnings from those state innovations. Unfortunately, the CSR investment in the social sector is significant in India, as we all know. Unfortunately, we don't have enough learnings, basically. And the major challenges of not having learning is that we have, as a social sector investment within our country, we have not really moved up our investments on the data. That currently the impact assessments by not all CSR, I'm not saying all CSR, because I always categorize CSR in three categories, that is matured CSRs, progressive, and maybe at the intermediate stage. And at each of these stages, the investments vary on the data. What is required is how the investments on the data can be channelized in such a way that every program that is invested by every CSR, we have sufficient learning in terms of what impact is it bringing and how that impact is channeled. At the moment, the challenge mainly remains to conceptualization of what those key questions are, as Dr. Sunita said, and conceptualizing what indicators or what kind of data that do I need to collect, whether it is a complexity that exists between quantitative data or qualitative. Is it more about how many sewing machines that I have distributed? Or is it more about how much is it that has empowered the woman? Or what level of the impact that it has brought into the society? The challenges is more about understanding what data is needed and how much data is needed, and the whole data literacy. The associated challenge is also about the resources and the investments in the programming, I would say.
Thank you. And I really liked your vision and your thought process around categorization of CSR. And I think that is something that will be very relevant to the audience here. So if you all want to learn more about that, you know the person to go to understand how he places you all in those different categories. But, given the fact that, and I will acknowledge that we all come from the pure play development sector, working with the government, working on public sector programs. So we tend to talk a very public sector language. And we're very grateful to have this opportunity to engage with a diverse audience which looks at also looking at linkages with, say, manufacturing or different thought processes. So on that note, Dr. Zoya, I'm going to ask you a question. That we have a very mature program, and we know that adolescents and young people are very critical to the future of the country. There's no doubt about that. How do we make sure that we have private sector participation? Dr. Poti talked about collaborations in innovations, and that the implementation will happen at its own pace. You already have a mature program. Where could they, and foundations, implementing organizations, research organizations are already part of those partnerships. How can the private sector, how can the CSR space also join hands with you, with the small, medium, and large funding that they may have, to be able to amplify at the state level or at the national level the efforts that are already in progress, so that we have a stronger youth population that is feeding into the companies that are there and the workforce, and also to a more credible social structure?
I think before I actually talk about all that, I just need to stress on the importance of how important an adolescent is. For a country like ours, we're not getting any younger. Our basic mean age now is about 28, and by the next decade, our basic age, our mean age will be about 38. So if we don't invest in young people now, we'll lose a huge opportunity for a country as big as ours. Right now, our population is more than 25 crores of young people, 10 to 19 adolescents. And these have been, we have had quite good progress in a lot of our interventions. Use of safe menstrual hygiene practices has gone up to 78% of people have, young people, 15 to 19 have access to safe menstrual hygiene products. Then we have decrease in teenage pregnancy has gone down, child marriages have gone down. But having said that, good things are happening, but we still have emerging issues which are still continuing, or we are having newer issues which are coming. So for example, we have the overburden of undernutrition as well as overnutrition. So we have looking at a twin peak in a country like ours. So we have undernourished children as well as overnourished. So we're looking at and in fact, India is called the next diabetes capital of the world. So young people have to be informed on how to have a healthy lifestyle, how to prevent non-communicable diseases. Other emerging issues which we have, of course, is increase in mental health issues in young people. One thing good is that at least we have started acknowledging that mental health really matters. It matters, it is as important, if not more than physical health. So any investment in improvement of mental health is something which is, I think I would say, the call of the day for young people. Young people, in fact, people who are going to school and going to colleges is important. Besides this, we have emergence of newer issues of use of social media. So how do we control, I mean, it's not control per se, but how do we ensure that the social media is used positively? Because there's so much on the social media. How do we ensure that what the young people, the adolescent watch on the social media is something which is right? So what is the kind of system we can put in place so that there are a lot of self-styled gurus on the net which talks about everything, right? From SRH to mental health to nutrition to diet to lifestyle, everything they talk about. So how do we do and inform our young people to make the right decision? So as I would say, government, as CSR, it's important for us to invest in what really matters right now, and that is the health and wellness of the young people, whether it is through establishment of what we call model adolescent-friendly health clinics. These are clinics at district level which are supposed to be centers of excellence, in which all the services for adolescents are available along with trained manpower, high quality of IC material, good linkages, training center is set up. That is something which can be done. Besides that, we do have young people, young girls who still don't have access to safe menstrual hygiene. Say it is just 22%, but that is a large number for a country like ours. So investment in that so that every girl has access to safe menstrual hygiene products, whether it is a sanitary napkin, reusable, reusable, tampon, menstrual cup, whatever. That should not be a reason why a young girl does not achieve her full potential in life. So small things we can do. And next, we also have the issue of anemia. Anemia, we are doing a lot of investment. In fact, Niranjan here, we are working with them on how we can look at good data sets to monitor anemia. Next, we have, I'm seeing Madhvi is here, yes. She has worked on a good app which looks at mental health issues, which now is, I think, covers a lot of issues. So that innovation has to come not just from CSI, I would say, but for every person out here, how you can innovate so that every young person out there has the access to the right information to make the right choice about their own lives now. Because young person investing in them now is not just looking at investment in adolescent health now, because these are the people who become adults. And if so, they want to have children, they'll be actually informed parents who can actually bring up the children in a far better way. So that is then, and we look at, I would say, impact of our programs, especially in a program like adolescent, it is very difficult to quantify impact because this is looking at behavior change, change in lifestyle, change in attitude. So that takes years, that takes a generation. So any investment now, I would say to all CSR people here, it's not that you will get numbers next year or maybe 2 years or maybe 3 years down the line. It's not like how many women got IFA tablet or delivered an institution or got vaccination. It's not that easily quantifiable, but investment in this will yield far larger outputs in years to come. So that should be the notion when you start investing in young people. You should think of you're investing in the future. No numbers, no immediate output, but yes, what outcome for a country like ours will be very huge.
And the improvements in quality of life that are coming in for people will be immense, and also the workforce participation, which will, of course, benefit. Dr. Rizvi mentioned social media, technology. Sunita, I want to ask you that, as you see technology evolving, and from your learning years as a researcher to now designing and supporting governments in research programs, where do you see that newer tools that are being developed, and how could there be a partnership between foundations, implementing organizations, and CSR to leverage these tools to accelerate investment in social development? And other examples, we've talked about health, so if there are examples from, say, livelihood or blended finance that you could talk about. And I'd also request you to not use acronyms. I know we're talking about SRH and those things, but yeah, that's sexual and reproductive health. We tend to do that because the minds work in a different way. But if you can think of some examples to share around tools and technologies.
Yeah, thanks, Medha. I think the biggest revolution in terms of the ability to understand social impact has come from the extent of digitization and digitalization that's happened. And India has really been at the forefront of this, where we have huge government platforms as well that are now digital. But we also have a huge amount of information, digital information that's coming out from social media platforms to many other not just social media platforms, so digital platforms. So if you look at livelihoods, we have digital platforms that are that facilitate the discovery of employees and employers, right? So job tech kind of platforms and so on. Education also has ed tech. We have lots of ed tech platforms that are emerging. And all of those platforms are generating data. And I think the big opportunity that we have is to actually make meaning out of all of this information that is being gathered through these platforms. And of course, making meaning also involves ensuring that people whose information is entering into these platforms are aware of how their information is going to be used, that there are appropriate consent architectures and policies and so on put in place as well. Assuming that we can get all of that right, and again, I think India is at the forefront in terms of trying to figure out how to handle all of this personal digital data. In fact, we also have the recent act that's been passed and adopted. So I think that's where I see a lot of innovation in terms of insights into how these different kinds of interventions and policies and so on are actually playing out.
No, thank you. That was a very useful tip that you reminded us about the laws in place. And I think as a country, we have a very positive framework to ensure safety and security, and that extends to the thinking around data as well. Niranjan, I wanted to ask you that, since we are on the topic of tools and technology, a challenge that one often faces is around how do you generate and how do you leverage high quality data for decision making? And it's just assumed to be a very cost intensive area. And people tend to think of it as an afterthought. So programming is design, but program data evaluation is sort of usually at a later stage. So as somebody who leads the thinking in that space, can you talk about how can that be made more accessible? Are there existing tools that people can just adopt and run with?
Yeah, thanks so much for that question. I think one of the connecting to what the tools that exist today in India, the data in multiple different data streams, I would say. One set of the data stream is the data that's being collected on a daily basis from various platforms. The other data set that includes some of these evaluations and the research that is being conducted in the field by the investigators. Many times in the social sector, in specific, what has been the challenge is that lack of understanding on, I'm coming back to the point that I made on the challenges, lack of that understanding on the questions, on how much data do we need for what kinds of evaluation questions that we have in hand, and also which technology to use, and what kind of a sampling method that I should be using if I am collecting a quantitative data or a qualitative data, and also about the data privacy issues. That if I input data, is this data going somewhere? And now with all the laws and as country we have moved far ahead and very progressive in that space. The other challenge is also about the analytical tools. And what we have been doing at Population Council Consulting for the past 3 years with a collective knowledge and experience of our research scientists, we have designed a digital data application, which will be a very cost-effective tool for all the CSR who is sitting here. And it's called MQuad, which is 4 M's in the MQuad. That is map, measure, monitor, and manage. What it does is that it offers a solution of to the issues that I've discussed and the challenges. And I'm actually proud to announce that it's been officially released. You can actually get more information from the booth, at our booth in number 31. And it's a first made in India product that will be available for all the CSR for their program evaluations to make it user-friendly, cost-effective tool that offers from the conceptualization. One simple example I would say is that the tool has got built-in 8,000 questions, validated questions, covering the range of multiple thematic areas, the health, nutrition, agriculture. You talk about any thematic area, the questions are all inbuilt. And that provides a guidance for individuals to choose, because these are validated questions and the indicators, and to use that. And it also has the data management and the data privacy completely ensured, confidentiality completely ensured, under the control of the client that it is using. And it has the provision for the analytics inbuilt, so that people can actually get real-time basis the information that they're getting to be used. So while it's not that this is a platform, that we have multiple platforms everywhere. The platform that we have brought out based on our years of practice in this space, in creating good quality data, we have given a lot of emphasis to the data quality. And that is going to become a very critical source for the future in India to make these social programs more effective, and that it could be a self-learning for the CSRs, that they don't need us, but the use of tools can actually help them create a more impactful learning. Thank you.
Great, thank you. And thank you for sharing about the tool. I'm sure everyone will go out and learn about that. I'm going to ask one question to all of you And I'd like you to approach it with your different perspectives. And after that, so about a 30-second to 45-second intervention before I open it up for questions. And we'll be able to take only 2 questions. So think about your questions while everybody here answers this last question. You've talked about how important data is in rewarding programs and strengthening programs. You've talked about quality of program. You've talked about beneficiaries of data, both at the policy level and the users of data themselves. What is the role that you feel data plays in building trust? Ma'am, for you, as the private sector looks at government, the need for data as a trust building of collaboration with the government. Sunita, for you, for people to share data to inform progress. And Niranjan, for you, how do you see data as building trust in continuing investments in the sector? 45 seconds each. My question was longer than that.
Okay. Okay, so data as a matter of trust between the private sector and the government. It's really important because I think government as of now is very transparent about the various public health interventions, which I'm going to take the health aspect only. So whatever interventions we have, whatever data we are generating from the data, that is always shared in the public domain. So it's not something which we keep secret. So that kind of ownership is there of the government. If some program is doing well, good for us. If some program is really struggling, then also it gives us an insight as to where we can improve. And that is where the feedback from the states, the implementing agency, whether they are NGOs, I've met a couple of NGOs today here also. So it's good to see that ownership is there from the field level workers also, the field level organizations who help us implement programs, because government reaches everywhere, but then a lot of times the last mile is covered by our own field level partners only. So that, I think that ownership, that trust is there between the government and our field level implementing partners, that whatever data information we share with them is accepted as it is, because that is owned by both the state government, by the implementing agencies, and as well as by the national government. So I think the matter of trust is not really something to consider, because we own the data which we share with everybody.
Great. So the act of collecting data and the act of providing data is one which is both fueled by trust or driven by trust and also reinforces trust. So I think the act of being asked questions related to, your needs, whether services are reaching you, how you're experiencing services, etc., is a symbol of the party that's asking those questions, their interest in you and their respect for you and their desire to help strengthen and improve your experience. And I think when a community member, a beneficiary, etc., whoever is responding to those questions or participating in a data collection exercise, they are entrusting trust in you by sharing their experiences, right? So I think the act of monitoring, measurement, evaluation, data collection in all its different forms is one that, as I said, is a symbol of trust and reinforces trust.
Yeah, I would say that one point on the, without data, we'll be shooting in dark for the programs. So what is critical is that often people misinterpret that data as a more investigative process. I think the key is what Dr. Sunita said on the trust, that plays a very critical role in helping and explaining what way the programs could be improved. People are today in the social sector programming are scared of data because feel that no, it will show us some failure. I think my take would be that unless you learn from failures, you won't be successful. So that is the trust that the people should have about the data.
Fabulous. No, I think, the points that you've all reiterated, that data is about respect, it's about trust, it's about transparency, and the government here is talking about transparency, availability. It's also about failure. It's also about lived experiences and informing future experiences and going from design to celebration. and celebrating failures as well, something that Sunita often talks about. With that, with those keywords, I open it up for any questions. We will have time to take 2 questions. I have one hand here and one hand here. Would you like to please introduce yourself and direct who your question is to?
Good afternoon. I'm Ashish from One Stage, aka Charities Aid Foundation India. So basically my question is to Dr. Zoya. As you are aware, we NGOs are always short on funds.
Yeah.
We are always crying about short of funds. And I have been hearing a lot about data and all that stuff, but a couple of questions. It's a one question, but 2 parts. So one would be, how can a government or any of the bigger agencies help us in establishing the digital platforms? Because as an NGO, as a smaller NGOs or a grassroots, this is the last priority, the digital platforms. And what I see is there's a need for IT interventions, which is very right, but the problem of funds is always there. How could a government agency help us in doing that? And second part is, Dr. Zoya, especially for you, how you ensure the integrity of data that is being fed at the ground level. We talk of data and all that, but how that a correct data is coming to you, I need to know the steps, how you show. Thank you.
Yeah, I think I'll take the second one.
Yeah, but let's take the other question also. Go ahead. Any women in the room who want to ask a question?
Hi, good afternoon. Wonderful session, though. This is more of a follow-up to what
Your
Ashish
name,
was also
please?
mentioning.
Your
Hi,
name.
I am Dr. Bhaskar from AI and Robotics Tech Park, Indian Institute of Science, Bangalore. So this is more of a follow-up question to what Ashish was mentioning, right? When we say data-driven decision-making, the biggest challenge is how good is the data which is coming in. So taking example of health again, ASHA workers and others from the field who feed in lot of data which comes in, the quality is at question mark. 2 challenges which I've seen myself is, one, what is the incentive to give me good data from the field? Second, what is the feedback? As a field worker, either a medical officer or an ASHA worker or an A&M, when they are feeding in, what are they getting back after feeding in the data? Both of these become the biggest barriers for them to give us good quality data. Are there any initiatives which can be good examples of this?
Great. And there's one question here.
Thank you so much. My name is Dr. Mayanka Ambade. I am Assistant Professor at IIT Mandi, School of Humanities and Social Sciences. So I just want to start from where Dr. Sunita left. It's about making meaning out of the data.
Yeah.
And I think that is a concern which both of the gentlemen have also kind of highlighted, is when we talk about making meaning, it is also about whether it is information generation versus knowledge generation. And when we have so much information coming in, we need manpower to generate that knowledge. And that's where academia comes in. But the academic engagement, as far my understanding is mostly at the senior level. So we have a lot of social science schools all across platforms. When we are talking about decentralized learnings from small villages, as Dr. Pati said, we will require schools which are localized, which are engaged, which are students who can directly contribute to it. So how would you, as a policymaker, think about engaging early career researchers and students at local levels and social science schools to be a part of this entire engagement? Thank you.
So just summarizing questions, Niranjan, if you can take the quality of data and how it's relevant to people. For you, around the question that he asked, and also around building partnerships. And Sunita, if you can talk about how smaller NGOs can develop programs, and he specifically mentioned digital tools and dashboards, but also around taking a part of her question around partnerships and strengthening local institutions, which I know is an area very close to your heart.
Yeah, thanks so much for those questions. I think I'll talk a little bit about how important, critical it is for the, 1 minute. So 30 seconds, maybe. So how critical it is, there are examples, that is, and specifically we are supporting, also working closely with the government for example, on HMIS, in terms of understanding how critical it is to ensure the data that is inputted is of a good quality, and what is that in turn that people are getting. That's the key work area that government has been very actively working on at the moment, to ensure that how the ASHA worker or the ANMs or the data entry operators realize the importance and the value of the data, and what data are they, is it going back. Until unless we give back that data to that last user, or create that importance of that data in the minds of those people, the data quality can never be solved as an issue. So, and in order to, for the smaller NGOs and the data quality on that front, that is where we have come up with this product MCOD, which actually ensures that what quality issues that exist in the data and how they can be addressed at local level.
So rather than developing new tools, using existing tools and bringing data back to the ones who are using it.
Okay, I hope I answer, because it's kind of very wide. So I would say there is data and there's data. All of you know that. So what the ministry currently is doing is that we are looking at what all data is collected, because we I think collect a lot of data. So a lot of pruning is happening in the ministry to see if that data is not being used for any monitoring or any program intervention, let's just remove it. And that is being done very aggressively now. So that I think is, it points to the fact that we as a ministry have realized that all data is not really needed. I mean, everything needn't be reported to the national government. If the state wants to follow, that's their wish, but not to the national government. So that is first thing which we have done. Second is that wherever there's data, HMIs, like you're saying, the incentive for putting in wrong and right data or over-reporting, that issue is always there with the states, but that issue is somewhat corrected by our regular National Family Health Service, NFHS, which is done every 4 to 5 years, which gives us a kind of an unbiased view of all the indicators, which are anyway a part, lot of them are a part of HMIS. So that helps us counter the states and say that, okay, you said 90%, but NFHS says 65%, you know. So states become accountable that how come over-reporting was there. So they also are replying to questions that how come over-reporting is happening, and then they ensure that the training of the worker who's putting the data becomes mandatory and is a part of the regular training system which takes place in the state. And third, I would also say that we also have our NSSO, which takes place, National Sample Survey, which happens, which again looks at a lot of health interventions. So I would say government is always looking to kind of put checks and balances in place to ensure that whatever data coming is of good quality and the accountability is rests with the state, the UT, the union government is there, but always checks and balances are say to just cross-check as to what is really happening, and then there's a lot of conversation with the states to compare the reports and to assess, and the states always come back to us, and then the discussion is there. So it's not as if there is, why did you do this, why not this? There's a very healthy conversation which happens in discussion about the over-reporting or under-reporting, and each division which is looking at that reporting is accountable. So I'm saying accountability fixing, explanation, discussions are a healthy way of moving forward. There is no punishing happening, there is no over-felicitation happening of data which we know is not possible. So I'm saying there's a lot of understanding and discussion which is important, and let us not just accept data as black and white, that this is right, this is wrong. There's a lot of middle grays which have to be understood better with the state, and that's how we work.
And having seen you as a program manager for as many years as I've seen, one thing that they do very well is a concept called the program reviews, learning, which is not just a data review, but it's a very qualitative review, and it offers a brilliant opportunity, which is cross-learning among states. So I think that is something that we must acknowledge you with.
Great, thanks. So I think on the partnership front, there's quite a bit that can be done. I think, for example, CSR funds could help set up networks within states, bringing together academic institutions, universities, etc., along with government and with NGOs to figure out, how can these different stakeholders actually play a role in accelerating social impact, particularly at the state level, given that states differ so much and there's so much heterogeneity in health and development outcomes across states. There's a real need actually for local institutions that speak the local language, that understand the political and economic context, for them to actually get involved in generating not just information but knowledge and insights. The foundation has been been working in partnership with the governments of UP and Bihar, and in those two states, we have been helping to bring medical colleges, IITs, NGOs, and other kinds of institutions together to partner on both generation of insights on problems and solutions, as well as to provide technical assistance where relevant. So I think there's a lot of opportunity on that front.
Fabulous, thank you. And as we bring this session to a close, I will take the frame that you said. There is information, and then there is, there's data, and then there's knowledge, and as you said, there's data and there's data. I think it's really important to look at data from a user perspective and data from a decision-making perspective, looking at it from a provider and a user perspective, and to use available resources instead of creating new tools every time, to use existing tools and resources that have been made by experts, to the extent of saying that they make people irrelevant and putting the data tool forward. You're very brave, Niranjan. And on strengthening data as the cornerstone for strengthening the purpose that we're all here for, partnerships for, as Dr. Poti said, taking forward innovation. So I think it's really about people here in this room to think of opportunities to collaborate, to use data for informing design, for informing learnings, for being respectful of failures, and for celebrating success. Thank you very much. I hope you enjoyed the conversation.